Herniile de disc sunt probleme frecvente în rândul populației și pot cauza dureri intense și disconfort. Pentru tratamentul acestora, medicina modernă oferă o serie de tratamente, de la intervenții non-invazive până la intervenții chirurgicale clasice. În minutele următoare vă invit să aflăm împreună care sunt tratamentele pentru herniile de disc. Domnul doctor, vă rog să-mi spuneți care sunt factorii de risc pentru dezvoltarea unei hernii de disc lombare sau cervicale.
Starting with cervical disc disease, cervical portion of our spine is the most mobile portion of our body. Therefore, the reason of the cervical disc disease is not a macro trauma, a major trauma. It's due to repeating microtrauma. For example, the whiplash movement while we are using the car with every brake and gas leads to a degeneration in our cervical disc. On the other side, lumbar disc, lumbar region is the most weight-bearing region of our spine, so that anything that increases the load of the lumbar discs can lead to disc herniation.
Care sunt simptomele unei hernii de disc lombare și ce simptome indică o hernie de disc cervicală?
In cervical disc disease, what we have is a cervical pain associated with a radicular pain. What we understand from radicular pain is an extremity pain, like an arm pain. So if you have a severe neck and arm pain, it's indicative of cervical disc disease. In the lumbar region, it's the same, but this time we have a leg pain. Severe back and leg pain generally indicates a lumbar disc disease.
Vă rog să-mi spuneți care este protocolul de diagnosticare a unei hernii de disc.
When a patient comes with such a pain, first we talk with the patient, we take a history, then we do a neurological examination, and after that we generally do an MRI examination. In MRI, we see the anatomy of the spine, so we are 99% sure. But in some instances, we may order an EMG to have additional information.
Ce tipuri de tratament recomandați pentru hernia de disc lombară sau cervicală?
Many of the patients doesn't need surgery. Many of the patients we can go with conservative surgery. What we understand with conservative surgery, the first step is bed rest and medical treatment. After bed rest and medical treatment, 90% of the patients are relieved from the pain. But if it's not sufficient, we continue with physical therapy and rehabilitation. If physical therapy and rehabilitation is not enough, and if the patient is eligible, we can do an algological therapy. What does it mean? It means doing a local injection to the spine. But if all these fail, then we consider surgery.
Cât de complicată este o intervenție chirurgicală pentru o hernie de disc?
What we do in lumbar disc surgery is called lumbar microdiscectomy. What we do a small incision in the midline in the back, and then we separate the muscles, and then we open a window in the bone. After we open the window, we take the spinal cord and the roots to one side to see the lumbar disc anterior to the root, and then we remove the disc herniation. In cervical disc surgery, it's a little bit different. In cervical disc surgery, we enter from the anterior, which we mean we make a transverse incision under the chin, and then we enter between the carotid artery and trachea and esophagus. And then we go to the anterior of the spine, we remove all the discs from anteriorly, and then we replace it with a disc prosthesis.
Care este stadiul pacientului eligibil pentru o intervenție chirurgicală?
If a patient comes to us and during the neurological examination, if he has a neurological deficit, what I mean with neurological deficit, he or she has a weakness in her arm or her leg, this is called a neurological deficit. If there is a neurological deficit, we directly go with surgery. But if there is no deficit, we go with conservative therapy. But after 3 months of conservative therapy, if there is still pain, we also go with surgery.
Care sunt beneficiile chirurgiei pentru tratarea herniei de disc?
As I said, surgery is the last option in our treatment scheme. But If we do a surgery, it's a definite treatment. We remove the disc and there will be no pain afterwards. Can there be a recurrence? In cervical disc disease, there cannot be a recurrence because we remove all the disc. But in lumbar discs, we remove only 70% of the disc. So there is a 3% chance of recurrence in lumbar disc surgery.
Cât timp durează recuperarea după o intervenție chirurgicală a herniei de disc?
The healing period after lumbar or cervical disc disease is about 1 week. But what we recommend that the patient should go back to work after 1 month. It's more ideal. But after 1 week, she or he can do anything she likes, but we like the patient if she or he rests a little bit more, so goes back to work after 1 month.
Aș vrea să știu care sunt semnele de avertizare a unei complicații legate de hernia de disc pe care pacientul ar trebui să le observe singur.
Disc surgery is a major surgery, so we have every kind of complication that a major surgery can have. But these are very, very small. For example, the risk of mortality, which means death, is less than 1 in 10,000, but it's not zero, of course. But most feared complication of disc surgery is having a paralysis, a loss in muscle strength. The chance of this is less than 1%. And other than these two most feared complications, there are very slight complications that can be treated, such as a skin infection in 2 or 3 weeks, and these are not important. But when we add up all the complications together, a disc surgery have a 2 to 3% of complications.
La final, aș vrea să-mi spuneți care sunt cele mai recente descoperiri în tratamentul herniilor de disc.
What do we have now? We have more developments in non-surgical treatments, conservative treatments, but surgical treatment has not changed in the last decade. So microdiscectomy is still the golden standard in disc surgery.